Good morning, guys. Today we are talking about bites and stings. Okay, so insect the stings and bites. What will happen means poison will occur. So mainly the honeybee cases and all we see. So venomous insect to the include honeybees. It's what's fire and all it will be happen. So that honeybees only stinking to the insect, leave that the stings and venomous insect begin. Okay, so that small one is there now. They're taking out. So use the force of and taking. That one is insects. Okay, so that one is poison for 2 to 3 minutes. After 20 minutes, we can remove that stings. Okay. What are the signs and symptoms of stink will be there means localized pain, itching, swelling, allergic reaction. It's not treated, but severe allergic reaction means it lead to anaphylactic shock. So it's maybe life threatening case. If possible to 30 seconds or 30 minutes, it will be death will be occur. Okay. So if you are a normal honeybee, it's first aid means clean the injury and remove the stinkers and venom sac and scrubbing with the hard objectives such as long fingernail and credit card scissor we can use and we can remove that objects. Okay, don't use the tweezers and forceps because of it could be swicks and stinker will be get more poison. Okay, so next wash the rainies and the bites area 5 to 10 minutes with soap and water. Drain affected area if your boys rise and keep, then apply the cold packs 10 minutes slowly that absorption of venom and relieve the pain and reduce the swelling. Tell them to go for medical emergency area, then monitor the vitals for response, breathing, pulse, and all. Watch the signs for any allergic wheezing or redness, swollen, itchy. At least 30 minutes to you should watch. Then assess the medications. What are the medication means if you're anabolic, antihistamine drugs and all we can use. So hydrocortisone, analgesic, epinephrine we can give. Treatment of anemic means epinephrine we can give. So it will be every 50 minutes we can re-inject the dose. So this one is scorpion stings. So 1,000 occur each and every emergency care it will be happen. It's not on poison, but it will be localized pain will be there. Okay, so it is a uh, desanctation poison scorpions for non-poison scorpions both is there, so it will be treated for medical emergency. It's need to urgent care of the children and elders. So how to avoid scorpion stings means if your live dry regions more activity at night it will be stings occur, so avoid by night walk and something barefoot and sandals and all avoid to walk and shake out the cloths before using. Then signs and symptoms severe immediate pain and burning will be occur. Numbness and tingling develop will be there. Muscle cramps and abdominal pain will be there. And trouble breathing and swallowing will be there. So what will happen means it's numbness and tingling develop and all will be there. Then muscle cramps, abdominal pain, and trouble to breathing and swallowing will be there if you're scorpion bite. So what are the first aid means? Wash the area with 5 to 10 minutes. Rise the affected area to forward. Apply the ice packs at least 10 minutes. Then relieve the pain and reduce the swelling. Monitor the vitals, especially breathing. So we call for 1 or 2. If any symptoms, if your patient go for any pulse rate reduce and go for harassments, you can give CPR. Okay. So mosquito bite. So this mosquito bite everyone knows. So seasonable, it will now it's a malaria season because of rainy will be there now. So it will be the malaria and dengue. So everything will be spread. The yellow fever, encephalitis. So first aid for mosquito means wash the area with water and soap water with 5 to 10 minutes. Apply the ice pack to the site and bite. So antihistamine, it's if you're needed we can take. Otherwise no need. So this is the most common case for snake bite. So yearly 7 to 8,000 people for affected to the snake bites. Okay, so maybe that snake bites and all what will be means alcohol using they will use and treat for all bites for poisoning. So antivenom available to many areas. So what will happen means here, depending upon the snakes, the venom may cause to local tissue destructions. So it may be block the nerve impulses and causing the breath and heart or to stop, to cause the blood clotting. That's why we can give whenever snake bite, we can give for anticoagulant drugs, for heparin, warfarin, like this and all we can give, because that venous blood sometimes will be occur to blood clot. Okay, don't attempt to kill. Okay, because some people after biting they will kill. Okay, so kill the snakes and brought give to the hospitals. So don't do the like this and all. So if you're it's possible, that with when patient it's affected, that time you can possible to bring for emergency areas. Okay, so most of snake bite it will be leads to death only. So for we don't know the such case. If you're after biting, we can see 30 or 1 hour after means it will be go for death only. Okay, so what are the signals indicate for poisoning snake bite means? So it will be here, that deep one or two distinct punch wound. First, see the pic wound will be there, and severe pain and burn will be occur to the wound site, and swelling within 5 minutes. Discoloration of the blue or black blue like this and all will be have to take 6 to 10 hours. Then full blister will be nausea, sweating, weakness, everything will be there. If your first aid snake bite means, first we can get away from the victim area and quiet and calm, because some people after biting they will shout and they will shout, then call for help, everything will do. That time what will happen, so that patient will go for giddiness and all. Okay, because poisoning going to spread to whole body, that's why. Okay, so that time we can don't run away the place and don't do like this and all. Just where you get the snake bite, you can stand, then you call for help calmly. Then don't tie anything, because if you're tying, there is a swelling more will happen, then there is a full blood clot will be occur. Okay, so help the casualty lie down, that head and shoulder raised, keep button area immobilable. So this is the button area. Why it's immobile means, if you're moving it will be go for the limb, through the limbs to upper limbs it will come. So it will be reach the level of art and everything. So avoid walking and moving if possible to prevent the venom to spreading, and call for emergency. Then it's must be administered within 4 hours. So wash the wound large amount of warm water to the temperature 5 to 10 minutes. Okay, so apply the on any elastic roll bandage, and to overlapping to the keep the pressure to the victim area. Then check the circulation pulse and everything to the, if you are getting lower limb you can check, if your upper limbs means you can check to the radial pulse or brachial pulse and everything. So we can see them, any discoloration anything happen means we can call for help. Okay, so here regardless what you have, otherwise means don't apply ice packs, don't cut and stuck the wound, don't apply any tourniquet, don't use to electric shock. Okay, so this is the normal snake bite to precautions and everything. So if your any bite will be, I can break the skin. Okay, that mainly will happen. So it's a main high risk. Okay, so here a risk of rabies is potential fetal viral infection for nervous system. The tetanus also potential risk of animal bite. So animal bite, what will happen means, it's a more of most of the people, 4 million people that street animal bite they will occur. Mainly the dogs is 80 percentage. It will be animal bites will be happen. So 30%, 30 people yearly they will die for because of rabies spreading. Okay, so if an animal bite, if a bleeding means it will be severe infection, so we can go for emergency medical area. So what will happen means, after biting you can stop and stand, don't run. Okay, talk softly and move slowly, and never turn to back on your dog, and stick moist pepper spray and all you can use. Okay, so if your rabies bite will be happen to risk of infection, so vaccine we needed. And some what are the animals we can assume, then warm blooded animals and all we can found, we can keep. Then if you spread the saliva means biting or licking anything is there, no cure once your symptoms develop. Okay, mainly that's why we are telling, after any small cat bite or dog bite we can go for emergency. First we advise to take vaccine. Okay, then here means what are the penetrated means it's attack unprooked. Okay, so acting dog or other animals until if you're friendly no problem, it's aggressive means you should avoid to stand that place. Yeah, so here mainly that for fox, dogs, wolf and bats and raccoons and all we don't go for there. Okay, so what are the signs and symptoms means mild fever, difficult in breathing, salivation, throat muscles got the spasm, then can't able to choke, laughter started for hydrophobia will be there, death occur 4 to 5 days. So animal whenever you occur animal bite, what will happen? What will should do means observe for 10 days. Star dog to or cat will be killed to head scent testing. Don't do that one. Then dead animal entered the body to send for testing. Try to identify the animal, but don't attempt for approach to trap. Okay. So first aid for animals burning, clean the wound with soap and water, and give the pressure for 5 to 10 minutes. Control the bleeding. Cover the wound. Sterile dressing method, and victim we can go for emergency treatment, and start rabies treatment for vaccine, kill animal and transport to the enter the body to the for rabies testing. Okay, wear gloves to avoid the infected to saliva. So human bites. So human bites, I think everyone knows. In our colleagues only normally will bite. Okay. So human bites carry only small risk. It's a transmit to the hepatitis HIV/AIDS. So who are people are hepatitis HIV/AIDS, everything is there means we should careful in the crowd area. It will be occur to more. So if anyone injected anywhere bite in a risky area, you should avoid. Okay, so any bites will be appear, we should clean the area, and thoroughly we can give wash the area, and we can give the pressure. Okay, so first we control, then we can apply for dressing, then we should go for emergency department. So spider bites, most are the venous but had to hard time to biting humans. Okay, so here signs some itching, swelling, localized pain, sight and bite, possible nausea, vomiting, headache, fever will be there. So first aid means clean the bite with soap and water, and apply the ice pack, and remove the jewelries before swelling happening. So bangles and all we can remove. Lower the sight, lower the sight of the bite is slightly level of the victim of the heart. Observe the at least 30 minutes for any allergic symptoms will be occur, and keep the calm and warm, limited physical activity. So observe to the any breathing issue anything is there, if call for if you call for a medical treatment, they will give for CPR and everything. Then we can send to the as soon possible we can send to the hospital. So today is last class is not last class, this unit last class is stings and bites. So kindly go through all emergency, if anything happen bites we can do the prevention to take for medical team. Okay, thank you guys, bye.